Now we're going to demonstrate a different version of getting passive range of motion. This is most likely going to be between weeks 2 and week 6 after a rotator cuff repair. And Krista is going to demonstrate with Matt how we can do that. He is simulating a left-sided shoulder rotator cuff repair. We're going to be protecting it. As we've said, we're shoulder blade pinching, and he's going to position his body in a way where we're going to do passive range of motion and maybe get the arm up just a little bit. This is a seated position. And so Krista, set us up here. What can someone do at home to simulate this kind of a position?
Use an office chair. Something with wheels is the best. Let your hand rest on your desk or your normal dining table, and then just roll backwards slowly. Again, just like with the walking back one, you want to make sure that you're not feeling a pinch, you're not feeling a big stabbing pain, you're not crossing that shoulder forward or bringing it up. As you're pinching the shoulder blades together, don't squeeze them super tight, just tug them together. You don't want to be locking yourself out in the back either. That way that shoulder blade can glide.
And I actually like this a little bit. Matt, can you come up a little bit here too? Here's my little 2 cents. I like it a little bit if your bodies rotate a little out to the side, because ultimately the shoulder natural plane is this way. So I always prefer it, if we can, if you're a little bit closer to matching where the shoulder blade sits, so you're rotating out a little bit like that. And now do the same thing as you're coming back, as you're noticing that. And what do you think about that one too? I think both of them are okay, right?
And a really good cue for patients or anybody is you want your hand at the angle of your eye. So if your hand is about at the angle of your eye, it usually puts you in about the same position.
And ultimately, while we evolve this, you can technically bring that even further, right? So Matt, if you go all the way out further, look, we're at 90 degrees, and as he's going, you can, if you brought this a little closer this way, you can literally get the arm all the way up to about 120. Correct. So the whole point of this is you can get a fair amount of passive range of motion with this way. And again, as we've said before, he's shoulder blade pinching as we do that to keep the roof of the shoulder up. And he's being very cautious to make sure that the pain is not going up really high. We're going just a little bump from where we were before.